Um, so I'm here. I'm just trying to start up on Facebook Live and Instagram Live, and I think Eldora and a whole bunch of other people. So, okay. Yeah. Sorry. Now my Instagram has started as well as my Facebook Live. There's always like a little lag time. I don't know if it's my internet or what. Yeah, I am a little tired and I look a little messed up. I just finished 2 night shifts in the hospital. They're pretty long. And I won't go over all the Hawaii news just now. I'm going to address more some of the controversies and some of the new news that's forwarding me a lot of the same stuff. And welcome to Linda coming in, and welcome to Lauren coming in from the East Coast. So before I get to the big one, which is everyone has been forwarding me that it's the viral video that's going on. There's that emergency room doctors, 2 of them. One of them is called Dr. Erickson, and they are from Bakersfield, California. And they're talking about how a lot of stuff we're doing is wrong and they do stuff differently, and essentially how COVID-19 is sort of being over aggressively. So I'll get into that later because there's a lot to say about that. Basically, they bring up some good points, but I disagree with a lot of their conclusions. Yeah, so I want to talk about a little bit of the update first. With some of the drugs, because there's a lot of new drugs, a lot of new theories going on out there. I want to explain a little bit about it. And Larry Ono coming in. Larry, I'll definitely try to give you a call later. I'm really tired right now, so I'm going to try to focus on the podcast stuff. And I will probably try to cut it short today because I'm just tired. I need to sleep. So the first thing is a lot of you may have seen some of the article, new stuff about famotidine. And so what is famotidine? Famotidine is Pepsid AC, okay? So a lot of you may have heard that in New York, they're studying, and a lot of you have heard of this as Pepsid AC. This is the medication that Asians take sometimes when they don't want to turn red when they drink. So it's a really sort of, again, confusing time because a lot of people are grasping at straws, and I think the initial thought was that famotidine, which is an H2, is, basically there's cells in your stomach, and these are part of a proton pump that regulate the acid level in your stomach, and normally it's supposed to help reduce the acid. And Marissa coming in, and welcome to Valeria coming in all the way from Ukraine. So a lot of people have seen they've seen in China, as well as some parts of the US and some studies, that people who were on this famotidine, or again, everyone knows it, Pepsid AC, with coronavirus, were dying or getting sick at a lot lower rates than people who took a more expensive, like Protonix or pantoprazole, or something that's more a proton pump inhibitor, not an H2 blocker. So again, those are the 2 medicines, H2 blocker and proton pump inhibitors, that most people take to avoid gastritis, stomach upset, and it's to treat it. So the point is they're studying this drug right now in New York State in a big study. Now, I don't know the details of the study. I got to look at it more. It looks like it's more retrospective, not prospective, not with a placebo group. There's just a group that they looked at that had maybe rates of taking famotidine or Pepsid. Now, the thought is, well, maybe, and maybe people will be less likely to get sick from coronavirus, or even if they do have coronavirus or COVID-19 specifically, that they don't go into the hospital, they don't get as sick. Think about it. All I have to say is maybe it's true, but you got to wait for the research, because again, this is starting to sound a lot like hydroxychloroquine all over again. Okay, so part of the problem is that it's not only, and also they're only looking at it at using IV Pepsid, not oral Pepsid, high doses of IV. So does that mean that everyone should run into the pharmacy and get Pepsid AC and take that when they get a COVID-19, or when they I don't know, just to prevent it even? And the answer is no, because this is hydroxychloroquine all over again. I will say that there are fewer side effects, and there's not as much evidence for problems related to side effects from Pepsid AC or Famotidine. One caution is that, again, there's a side drug called ranitidine, or it's otherwise known as Zantac, and the FDA from the shelves a while ago, within this last year, because there was a tainted batch, and so there was stuff that was wrong with the medication. So that's, again, to caution you that just because you hear about ranitidine, it may not do anything at all. It may be coincidental that you had people that were on it in China or even in New York and they did better. Again, wait for the research, but I just need to mention it because you're going to see all the articles about ranitidine coming up and how it may be against a wonder drug. Now, it was never meant to be an antiviral, just the same way that hydroxychloroquine was never meant to be antiviral. It was meant, or an anti-COVID-19. Again, hydroxychloroquine was a rheumatological anti-inflammatory medication. Ranitidine is a stomach medication. And welcome to Mabel coming in on Instagram Live. Another new thing that they are starting to see and talk about is even nicotine. Just to tell you how crazy stuff is. They're actually saw, and I didn't have enough time to read up about it, that nicotine, that nicotine, the nicotine that you get when you smoke, is supposedly, they're showing some evidence, I don't even know how they study this, that it might be protective. So you may think, this is kind of crazy. Shouldn't nicotine be bad for you? Tell everyone to go smoke, or put Nicoderm patches on, or nicotine patches on to protect themselves. And again, I don't know how they even look at how some of these medications and drugs work to bring a protective effect, or how they found it initially, but it's not to say that it should be good and that it should work. Again, I'm more of the thought, and I have evidence from it, but generally, if you have lung disease, if you're coughing a lot, if you have chronic obstructive pulmonary disease, emphysema, in other words, if you're someone who smokes a lot, I think generally that's a risk factor for doing poor in COVID-19 when you have it. So I would prefer that no one gets any nicotine unless it's proven by tests that you do get a good result from and a protective. Welcome to Janet coming in from San Francisco again. Welcome to LaShawn coming in. Yeah, so LaShawn, it's weird. That's exactly what I think. It's worth looking at that research, but I would be shocked if nicotine shows a protective effect. So I think, again, we're at that stage where everything and everyone is trying to find out if anything works. They're literally it's like throwing dog crap at the wall, and they're just seeing what sticks. Now, again, as you all know from my maybe last two podcasts, or some of you that haven't joined me for a little bit, all the drugs they've studied have been proven not to work so far, or so bad that the NIH, the National Institute of Health, has said they cannot recommend anything. They cannot recommend hydroxychloroquine. They cannot recommend remdesivir. They cannot recommend steroids. You may have heard of steroids like hydrocortisone or Decadron or dexamethasone. They cannot recommend clotting medicine, even though there's a lot of evidence, again, that people have clots and strokes and everything. So, and obviously, like LaShawn is joking on Instagram, they cannot obviously recommend Clorox, and obviously I'm not going to go into all the stuff. Hopefully none of you are seriously considering what everyone about this week, which was that President Trump said that, injecting bleach or bathing in sunlight or whatever would cure this, just because one article showed a possible causality that the coronavirus and COVID-19 lives less in the presence of bleach and in the presence of sunlight. I mean, I really hope that people are not that gullible, but apparently some people are, because they did answer a lot more poison control stuff, in certain states. Now, again, I don't want to play politics because I don't know that I don't think there's nothing to be gained by this. Would you rather be right, or would you rather make a difference with something? The time to blame someone will be later, whether it's blaming Fauci or Bill Gates or the funding to China or something else, which I want to get into, because a lot of people have forwarded me that stuff about Fauci and the National Institute of Health funding $3.7 million to China, blah, blah, blah. So I'll go into that right now. So it sounds like, and Valeria says, thank you. So glad to see you smiling and in good mood. People are a lot recently. Yeah, it's hard because there's a lot of negative news, and I've even posted up some of it, and I'll go into that later, about this is starting to take a mental health toll on people with quarantine. And there's a lot of reasons why people want to reopen. So answering a few more questions right now that I've sort of given a little bit about my spiel about the new medicine. Greg asked, am I concerned about reports about people in their 30s and 40s having heart attacks, attacks that are being treated for COVID? And welcome to Amy coming in from Las Vegas. So Greg, I am a little concerned about it, but I'm not surprised, because again, as we've always said for a while, Greg, this is a multi-organ disease that happens. And again, to summarize for a lot of people who may not have caught up on the last couple podcasts, the thought is, and I've talked a lot again to my doctor friends in New York, there are two stages in this disease. There's the initial viral phase, which is less severe when you're more short of breath and maybe a little less oxygen. That's when the virus is replicating in the early stage or even the intermediate stage as you're just getting hospitalized. And then there's the end stage, the really advanced stage, what they call the cytokine storm phase. Everyone has heard about the cytokine thing, and the inflammatory phase. And then Greg, to answer your question, a lot of people think that these problems with young people having strokes, with having heart issues and heart are related to this cytokine phase where your immune system is fighting against itself, fighting against the heart, fighting against the bloodstream and causing clots. I'm concerned about it, but I'm mostly concerned about it for the sickest people. And so, Greg, you may ask, well, why are the 30s and 40s people having that? They may be having it more, just like, again, some people who are 30s and 40s and healthy die of the flu. So I am concerned about it, Greg, not specifically for the 30s and 40s people, but I'm concerned about it for anyone. So essentially, we have to worry about, and the heart issues are not your standard heart attack. From my understanding, what's happening with some people is that the heart is getting attacked at the valves or the general heart muscle in what's called myocarditis. Myocarditis, what is that? That's a fancy way of saying the muscle of the heart is generally inflamed and attacked by viruses. Now, I've seen myocarditis. I've taken care of people with myocarditis. It's very scary when it happens, and it can kill people. It's killed a couple of my patients, even young patients. I've known people who are very, very young without any problems. They've died of myocarditis. And this happened years ago when I was in residency. So it's very severe, and it can kill someone. It can cause sudden heart failure, sudden problems with breathing, and basically a heart attack. It's not just one part of the heart, like you get a clot in an artery and you get a heart attack. So it's, again, like coronavirus and COVID-19 specifically, I mean, can cause a cytokine storm and inflammation of everything, of the heart, of the lungs. That's the ARDS, of the kidneys. That's why people get on dialysis. So it causes multi-organ failure. So I am concerned about that, Greg. So again, to answer some of the other theories, okay, because I know, especially we have Jackie from Jackie Oahu coming in, these questions too. There's that big theory that, you know, Fauci and the NIH funded $3.7 million back in 2015 to fund the Wuhan lab and study coronavirus there, when they were told that they couldn't do it in the US, and that now they're studying that maybe the Wuhan virus did come from the lab, and maybe Fauci is to blame, and the government is to blame, and Trump is to blame, and, you know, or Obama is to blame, and a lot of this other stuff. This has appeared in a lot of right-wing conspiracy websites. The one I saw was the Next News Network. It sounds like CNN, the NNN, and they've talked to a bunch of other doctors. I've looked into some of them. Yes, it is true that the NIH did fund $3.7 million generally to the study of coronavirus. But what they get wrong is that this money was not all to the Wuhan lab. You can look it up. It was spread out over a bunch of different labs to generally look at coronavirus stuff. And that was to study swine flu and other things. On top of that, it wasn't given all at once. In fact, that money was given over years. 2015, 16, 17, 18, 19. In fact, it was like $900,000 each year, from what I understand, which means that even Trump was still giving this money. It wasn't just for Obama, it wasn't just Fauci. On top of that, Dr. Fauci wasn't specifically the one who earmarked this money. I mean, in the end, you know, who knows what we'll find? Maybe it was related to the lab in Wuhan. Maybe that lab was partially funded by NIH money. And maybe, you know, there is that tragedy that it was released. I'm just saying there is no proof about it. And even if there is eventually proof that that happened and that China is to blame, that Fauci is to blame, or that the NIH is to blame, I mean blame as in being partly part of this process that released the virus, what does it do right now? It doesn't help solve the problem. Again, would you rather be right about these conspiracies, and I say conspiracy now because that's all it is right now, it's nothing's proven, or would you rather make a difference? Again, I'd rather make a difference. And again, I think this will go into a little bit about that big viral video. I know every single one of you probably has seen it, or it's on your Facebook feeds, again, by Dr. Erickson and another doctor, who are Bakersfield doctors. They are real doctors who mention about, and I haven't watched the whole video, but I've seen a summary of it, about how maybe shelter-in-place, stay-at-home orders are too extreme, and that we should be letting people out more, and that this is still, quote, like the flu. Some of the things that they bring up are legitimate, that there are going to be issues related to people staying home. There are people who will be abused more, both child abuse and domestic abuse, that there are people that have mental issues related to this. Again, you've seen it, the article I forwarded in my Facebook, the ER doctors, a main one in New York City, part of the New York Presbyterian Hospital, killed herself. There's a nurse in Italy that killed herself when she thought she gave COVID-19 to people. So it's not without its risk to people at home. No one's making money. No one is arguing that that is a problem. But what is the risk? The bigger risk is letting people go out and do everything, especially as people are going out in Georgia and Florida and slowly doing that. Now, the problem that they say, that Dr. Erickson and his other doctors say, they noted, and you can even see by antibody testing, even 19 to 25% of people tested were positive for COVID-19 antibodies. And so the argument is that, oh, well, there's so many people that are positive and they're not really sick or getting intubated or dying, that you should just let everyone go, and that there's a high rate of positivity. Now, that is what I call selection bias. What is selection bias? They're testing the people, I talked about this last time, that come to the ER, that come to the urgent care clinics. And again, this Dr. Erickson is part of an urgent care clinic. So who shows up to these clinics? The people who what? Think they have COVID-19 or were sick or have symptoms. So they're testing asymptomatic people. They're testing people who already have a high likelihood of being positive. They're not testing everyone out in the street, the hidden senior citizens and the children, let's say. and the young people in high school that, they aren't testing everyone. So maybe, yes, the rates are a lot higher, but they're using very bad statistics. That's like saying if someone came into the hospital, right, and got tested with like facial droop and like having a headache and dizziness, that 10% of those CAT scans are positive for a stroke, that you can say, oh, well, that must mean 10% of society has strokes hidden, that we just know. We should just, if we scan a head CT scan, 10% of society, they have strokes. That's obviously not true. So this is what I mean by selection bias. And that's why I do not trust those doctors who are urgent care doctors who've been taking care of something like this. I talk to my ER, ICU friends who are doctors, real doctors in New York, and it is nothing like the flu. And I'll go into that a little bit, but I'll answer some other questions. Okay, John says, what are the odds on vaccine error? Seems low, and I also hear about reinfection reactivation. And Lauren mentions in New York, they are doing samples outside grocery stores last week. So Lauren, that's a good point, that they are doing samples and taking tests in New York, but New York is a zone. It is a hot zone. They are definitely not doing that everywhere. In California, they're not doing that in Hawaii. And there's certain states that have better rates of testing, Rhode Island, New York. But I mean, that's the point. You cannot extrapolate one state's findings to another state. Certain states are doing really poorly. For example, Kansas has done like very few tests. So every state, every country is testing in a different way. And I'll go into John's question about what are the odds of vaccine and reinfection, reactivation, and immunity. Okay, so this is another big thing that a lot of people are asking about. Welcome to Natalie coming in. That there is this question about, number one, they're saying that they cannot antibody tests, right? Why are they saying that? Because now the NIH is even saying, don't trust your antibody test because, and I made that mistake, or maybe not mistake, but it's not proven that IgG and IgM, if you're positive, even if it's a test, remember, a lot of these tests are not good. You need a test that has good, greater than 90% sensitivity and specificity, that even if you have IgG, IgM, that doesn't mean that you're definitely immune. And so I think that's what John is talking about, this idea that, or at least he put it up and then I think he took it down, that immunity may not be a given if your antibodies are positive, So that is a concerning thing, because we had mentioned, and I even mentioned, that possibly we could use those antibody tests to figure out who is less at risk and could put people to work and open up industries, as they are slowly doing in Georgia, in Texas, in Florida, and they're considering doing in other places, even Hawaii, even New York by middle of May. So it could be anything. It could be that if you have IgG and IgM positivity, that every one of those people is going to have some long-term immunity for a while. Or maybe it means the worst case scenario, that it means nothing, that it just means that you got the disease, but it doesn't imply long-term immunity. Maybe those antibodies are very weak level and won't fight off infection. Maybe it just means that you got it, but you're not immune to it. The reason they can't say that is they haven't seen the studies that showed following people that have IgG and IgM for COVID-19, and then you follow them for what? For like 2, 3, 4 months and see, are those people, is that population immune from getting COVID-19 again? Do they, number one, do they just get it at all, like by having a viral load by PCR? And number two, do they have any symptoms? Do they start to develop fever and cough and shortness of breath again and need to get treated, or God forbid, die? So those are the problems with immunity and the antibody test. And it's really sad. I've had more friends who've actually taken the antibody test, paid a lot of money, $120 out of pocket to take this. Not a single one of my friends who's taken it has the antibodies yet. Granted, they weren't really sick. Like my friend Brian, who's been on the show before, or mentioned it, he had the he was positive for COVID-19, but he hasn't taken the antibody test yet. I don't know anyone yet who's been sick from COVID-19, confirmed, and taken the antibody test yet. So there's a lot of these questions, and we do need more testing. So more questions. Stacy asks, what about pregnant women? And it's also like rewarding people to go outside and catch the virus. Yeah, it's not. You see, this is what we're worried about, because the other problem with the antibody test is that we're worried. I am too, and the government, all over the world are worried that if we just tell people with the antibodies, IgG, IgM, hey, look, you're fine. You can go out and go back to work and maybe even go to the beach and do your things, that this will lead to what? A big part of population won't be social distancing. And then other people will get lazy and say, hey, look, that guy's not wearing the mask anymore, or she's not wearing the mask, even though they still should. Remember, that's the other thing. Even if you are immune, you could have COVID-19 all over the place, all over your nose, all over your hands, all over your feet and your ass and like everything. And just because you're not getting sick from it, it doesn't mean you still can't spread it to anyone else. So that's what they're worried about, that if they tell everyone that it's positive and you're immune and you won't get it again, that will lead to that. So even my caution is that even if they find out that antibodies are positive and are conferring immunity, please don't be that person that doesn't and acts nah, like I'm gonna go out, I can go drink and I can go run around and I don't need to wear a mask. You should still do it, because you could still get your friends and family and everyone sick, okay? And LV, welcome LV. LV's my old coworker. She says, Waikiki doctors are doing the antibody testing. What do I think about it? LV, I've mentioned it from other times that I think it's a crapshoot right now. All these clinics, all of them, they are only using tests that they bought from a bunch of labs that got emergency authorization by the FDA. They are not what is known as FDA approved. They are only FDA emergency authorized, okay? So these labs and their testing, again, the labs are not making their own tests. They're buying it from places like different different companies. And I'll go into one of them called Everlywell, that Hawaii had been planning on buying 2 million of these tests, and now there's some controversy. I have to mention, I have one of my friends is the PR person for Everlywell and the marketing person. So there's a big controversy around these tests and whether they are sensitive enough. And again, every state is using a different test, and every clinic within every state is using a different test for antibodies. So what I think is that it may be worth it to spend that $125, $150, whatever it is, to get that antibody test. But number one, again, find out what company that they are getting that test from. And number two, find out what the sensitivity and specificity is. And if it's not over 90, 95%, I wouldn't trust those results. And number three, realize everything I've said, that even if you have IgG positive, IgM positive, that may not mean that you have long-term immunity from it. It might mean that, but it might not. It might be short-term immunity, or it might be nothing at all. It probably does mean that you were exposed to COVID-19, and that even whether you had symptoms or didn't have symptoms, if your antibody test is positive, then you were probably exposed to COVID-19. Or if it was a false positive, that you might have been exposed to something else that cross-reacts with the antibody test, with a coronavirus that caused another, sickness, but not the COVID-19 coronavirus. So Stacy asks, do I think Hawaii is trying to contain the virus? Stacy, I don't know what they're thinking. My idea with what I see they're doing with Lieutenant Governor Josh Green being master's in public health and an ER doctor, and what they're doing by still extending the stay-at-home place orders, even after, again, we're doing great. We're at the point where we only have 2 cases a day, 4 cases a day. We only have people dying like every other day or every third day, but we're keeping those quarantine rules in effect for visitors, everything. So Stacy, I think Hawaii is trying to is doing, and now I'm getting into a little bit of the global news and jumping around. And everyone has seen, New Zealand. Even my friends are sort of bragging, "Oh, New Zealand's doing great. We've eliminated the disease. We've gotten to where we want." So I think Hawaii is in a very similar position. We're an island. We're geographically isolated. We have a lot of advantages and keeping people out. No other state in the world or in the country besides Alaska can keep people out because they can drive across the state border everywhere in every other state. They don't just fly in. Here, in order to get to Hawaii, you have to fly in, unless you're a really good swimmer or have a boat. Again, I have a friend from Panama who just arrived in Big Island after sailing his boat 3 weeks from the country of Panama because they wouldn't let him in there and they're going to quarantine him offshore. So he sailed 3 weeks to get to Hawaii, and now he's quarantining in Big Island. So Stacy, to summarize, I think Hawaii is doing some version of trying to contain and eliminate the virus to do the point that if you only have, 5 or 15 or 20 cases or something reasonable per day, you can contact trace every single one of those cases and sort of COVID-19 and figure out, where did these cases come from? Did they come from someone in the community? Did they come from a visitor? They come from someone else. I do believe that Hawaii will keep this 14-day quarantine in effect for any visitor, and that the only way to be able to not be part of that quarantine in the hotel is rapid COVID-19 test when you arrive at the hospital. What I'm worried about is who's going to pay for that? The state of Hawaii? That's going to sort of bankrupt us. We give a free test to everyone that arrives. Think about how many people would want to do that and just let the state of Hawaii pay for it. Who's going to pay for it? It's not going to be the federal government. I don't think so. So I think it would have to be a thing where the state charges people and tourists who want to come in an extra $100 at least, or 100 whatever dollars it is for the test. And then they say, you got to stay in your hotel room for 2 days or 1 day or however fast it turns around. And then you're quarantined until that test comes back. If it's negative, go have fun. Welcome to Hawaii. Aloha. Here's a Mai Tai. Here's a flower lei. And go and hang out with everyone and go to your luau and shake your butt and get your kalua pig. I think that's what's happening in Hawaii right now. So I'm really happy to be part of Hawaii because we have very few deaths and very few per capita deaths and per capita cases. Again, I am part of that in Hawaii. I can confirm without releasing too many details, the hospitals still look pretty good. They're not completely empty, but we don't have a lot of COVID-19 cases. That a lot are recovered, something like more than 80% of our cases are recovered. And very few of those that aren't recovered are actually in the hospital. So they're milder cases. Marissa mentions her case, her question or comment is, as New York and tri-state area are coming down the other side of the curve, do I see a second wave coming as we open certain sections? Marissa, 100%, I see that second wave. I predicted already. And I'll tell you, and I've said this before, when do I predict it? It's just based on logic. It's based on the incubation period, right? What the incubation period is for COVID-19. Days, right? That's what they're doing with the quarantine in Hong Kong and in Hawaii and everything else. The quarantine is 14 days. Because even if you're asymptomatic, ideally you should have recovered from that, what they've seen in studies, in 10 to 14 days. So do I think we're going to get a second wave right away? Like in California, where you've seen these pictures of the beaches, Georgia, where God, I cannot believe they're letting movie theaters open and barber shops and salons and all these things open up. Do I think it'll happen immediately? No. I think it's going to happen 10 to 14 days from now. So what I really believe that everyone is starting to be happy. Market too. Everyone's pretty happy. Like, oh, we're reopening stuff. People have not learned their lesson. People have forgotten everything that you should have learned about COVID-19, which is what? Don't look at the wave hitting us now. Look back. Look at China. I'm going to look at those places, at Singapore and Japan and whatever. And so when do I think we're going to get our second wave? I predict we'll get our second wave by June. In other words, everyone's going to be really happy for most of May as all the states slowly start opening stuff and people can go get a haircut. People can go to the beaches more. People can even maybe go to a restaurant where they practice social distancing, that do that. I'm worried about that. And I am worried about that issue. It looks like I'm having some trouble with my Facebook video here. And so I'm not sure if it's actually going to be saved. So hopefully this will get saved on my Instagram story and then I can repost this in case there's a problem. So if anyone is out there on Facebook, if you can just write a question so I know that you can still see me, then that would be useful, okay? If not, then I may have to end this live video and do it again. So anyway, my point is that I think the second wave is happening in other countries already, and I believe the second wave will hit the US in 14 days, in 2 weeks, in other words. So everyone will be happy in the beginning of May, and after May, it will be after the middle of May is when I expect those states will have a problem. And Lauren mentions, Lauren, can you write and tell me, can you physically see me on video? Because I'm seeing on my screen that people are having problem playing, Facebook is having problems playing the video right now. So Lauren mentions New York may be July, August by the time we open back up. Lauren, and I agree with that. Okay, Derek mentions I'm still on. Okay, so I can't see myself, but hopefully you guys are still seeing me there. So, you know, I still think that that's really good because New York, again, was hit very, very hard and very fast. And so I think New York should be very slow about opening up. Let Georgia and Florida be the canary in the coal mine. Let them go first. And we'll see if that slow amount of opening certain industries leads to a big spike in cases by the end of May or June. That's our answer. No one should open up again, right? That's really the question. That's really the question everyone's asking. Is the social distancing not working and it never really worked and we shouldn't be doing it and we're being too cautious? Or is it like, I think that we still should social distance on some level? Valeria, I'm sorry, I ignored her question. Valeria from Ukraine said they asked people who got COVID-19 whom they've seen for the last 2 weeks and testing all those people. Do they do the same in Hawaii? Just curious. Valeria, Hawaii is not as good as the testing. It sounds like other countries like Ukraine and even in New York City or in certain places like I think Germany and South Korea, they test everyone, whether they have symptoms or not. And that, again, that's the thing. They test everyone. And because they test everyone, they get good data and good results. The US, remember, and I'm checking my, my statistics right now, the US has only tested, as of late, they've tested again 5.6 million. So again, 5.6 million is not even 2% of America. 1% of America is 3.7 million, and they've only tested 5.6 million. So they haven't even tested 2% of America yet after all this time. The ideal situation is where we test, and the government admits this, that we test 1% a day. 1% is 3.7 million a day. That's what they're saying will allow us the data to see if we have herd immunity and, you know, get more information and be able to do stuff. But we can't do that. We can't test that. Or what they're saying is specifically that if they can test in each state about 150 people per 100,000 population. I don't know why they picked that instead of 1 million. If each state can test 150 people per 100,000, that will give us enough data to figure out whether we can open back up or do different things. Derek mentions that California and LA, or LA specifically, saying May 15th. Now, I agree with delaying this. I mean, I would rather be in a state or city like LA, California, Hawaii, New York that does it last and later. Why? This sounds really bad, but every other state is being a guinea pig, right? Every other state that's opening up first right away, that's Texas, that's Georgia, that's Florida. They are going to be the ones that suffers. If there's a second wave, by the time they figure it out, they can stop stuff right away and go back into lockdown, but that wave is still going to rise. Remember, you can't stop that wave once you already let it start. It's like looking at that second wave on the horizon again. And to talk to Amy brings up a question. I've heard people were entertaining that idea of placing about 70,000 plus homeless people in some of these empty hotels in New York. It must be a fluke, right? Amy, I didn't hear that they were planning to put all homeless people in shelters or in hotels, but I know they are worried about it. For example, in Hawaii, we have separate homeless villages that are separate from the normal homeless shelters and normal homeless areas because the state is worried that if homeless people all live side by side, that they'll spread it to each other. So they are worried about homeless people that are living side by side, but I don't know what each of the states are doing, what New York and what everyone else is doing. For example, in Singapore, again, where they saw their second wave started was migrant workers. So not homeless people, but these migrant workers, the poor, minority people that work in the food stands and the food trucks that don't have a lot of money, that live in very tight buildings and spaces, they were the ones that started the second wave. Because what? Population density, right? The same reason why New York had a problem, because you have population density, even with the rich people. So Valeria started to say, in Kiev, they started to sell tests in pharmacies, but no one would want to buy or check it, huh? Yeah, so again, Valeria brings up a very good point, because it's not just Kiev and Ukraine, it is also Hong Kong. Some of my friends in Asia said, yeah, that pharmacies, you can literally buy antibody tests in the pharmacy. You can spend whatever money, like $100 US, $125 US. But again, as I mentioned, what does this antibody test tell you? Number one, is it from a real lab that works well? Number two, is the sensitivity and specificity good? In other words, low amount of false positive, low amount of false negatives. And number three, what will it tell you even if it says you're positive and you're exposed already? Does that mean you're immune? Would you trust your life on that? Would you trust going out in public, or would you trust that information to protecting your family and everyone else? And even if you're positive, but let's say your family or friends or your loved ones or your grandmother, grandfather isn't positive, even if you all take the test, then what can you do? You can't really change your life, right? You still have to protect everyone in your home, unless you go out and live alone by yourself right now, in order not to expose them when you put yourself out at work. So it's very, very complicated what they're going to do. Lauren mentions all the winter birds will come to New York from Florida when the second wave hits again. Yeah, Lauren, so you're right. So there's a joke, and welcome to Sam from Instagram Live. So Lauren, there's always that joke, and we know because we grew up in New York and Long Island, we have a lot of old Italian, anyone, but a lot of mostly like Jewish and Italian people who get old and they are seniors, and they call it like winter bird phenomenon, for having gray hair. They go down to Florida. And again, why is that a problem? Because Florida has a higher level of older people. Again, they're sick, or they're more likely to get sick, and they're more likely to die, right? That's a problem. It's kind of like why Italy, one of the theories why they had so many problems with so many people dying, because Italy had a lot of older people that were alive, and a lot of Italian families. If you know anyone Italian, I've been to Italy, I don't even know, 10 times. And your typical Italian family, when you look up at these beautiful old buildings, is like 3 or 4 generations of Italians living together. The young people, the parents, the grandparents, maybe even the great-grandparents, they all live together in a smaller apartment. Even the Italians I knew in New York, they did that, So it's a problem that you don't want to think that just because you're positive and with antibodies that you can go and do everything. You still have to think about not just the public and the health, but everyone else. Okay, and this is, I want to talk about this a little bit, because I know a lot of people mention herd immunity. What does that mean? I want to go over this again, because I went over it a little last time. And when did you first start hearing about herd immunity? It's two countries, again, UK, right? And also UK and Sweden. Sorry, I was checking some of my messages on Instagram Live. So UK started it early, and they quickly realized people were getting sick, and they stopped, especially when Boris Johnson, who, God bless him, already recovered from the ICU and is luckily alive and can lead the country again. They stopped it, but their herd immunity experiment didn't work well. Sweden was bragging about it for a while, and they did some things right. But again, if you look at Scandinavia, compare it to Denmark, Norway, and Finland, their amount of cases per capita or per million and deaths per capita per million are the highest. They may have less than the other countries, but they are not doing well compared to the rest of Scandinavia. And the idea of herd immunity, and what I like to say is more social immunity, societal immunity, not herds, because we're not cows and animals really, is the idea that I like to use the club example, the crowded club. Now again, take 100 people in a crowded club, right? Now, remember, say you walk into a crowded club and there's like, I don't know, there's like 10 people who are sick in that crowded club, right? And there are 10 people that are sick. You walk through that crowded club of 100 people, what's the chance that you are going to get sick from one of those 10 people is pretty high, right? Especially if it's even higher than 10%. Now, again, they're saying 20% in New York, maybe 25% of people are potentially sick, right? Neil asked, hey, bro, can you see this if you haven't? Neil, I mentioned this. You got to look at my first part of my podcast. You're late to the game, man. I know. Dr. Erickson from Bakersfield and the urgent care ones. Yeah, they're all downplaying the virus. They're wrong. They're wrong. And I'll tell you why. It's, again, about their statistics. They're wrong. Completely wrong. And I will talk about it, but I've talked about already about why they're wrong. They're downplaying it because they're saying a lot of people are having it and they're asymptomatic. And what I'm trying to say is that even if you go in this crowded room of 100 people, and let's say like 20% of them have the disease and the COVID-19, what's the chance when you walk into that crowded room that you're going to get it? The chance is pretty high that you'll bump into them or someone will get it if you're not all immune. Herd immunity, but then say you walk into this 100-person room and like 60 people are already immune from it, right? They're already immune, and then now will you run into 10% of those people that have the disease? The chances are lower because you're more likely to run into someone that is immune to it, that isn't asymptomatic and shedding it, right? That's how herd immunity works. You need a certain percentage of the population. So how do you get immune to it? Only by getting the disease, number one, and recovering, or number two, getting the vaccine. My point is, and I'm probably doing a bad way of explaining it, the only way to safely get herd immunity is to have the vaccine. Otherwise, you risk exposing everyone in society to this, including the older people who may get really sick and die. Now, you could say, well, why don't we just let everyone who's younger get the herd immunity and then they won't infect the old people that will die as much, you know? That's, and welcome to Cynthia checking in. I think it's Cynthia from Latvia checking in. So Stacy also mentions on the subject of herd immunity, since we don't know if there's immunity or how long immunity can last, and assuming we never get a vaccine, what if immunity ends up lasting a year or two, but we miss that boat due to social distancing? Stacy, that is a risk. So that is the risk that we never find a vaccine. Now, Fauci and most doctors you talk to think that we will get a vaccine. The argument is we've never made a vaccine against coronavirus or paramyxovirus or rhinovirus or the common cold. So what makes us think that we can get a virus vaccine to this virus now? I just have to assume that we can have that chance, and it may take a year or a year and a half or even 2 years. But in the meantime, Stacy, the point is that even if we didn't get that herd immunity, we still saved these older people from getting it, or at least gave them a chance, you know, bought them another half year, bought them another year of survival before they died, you know, so that people could still spend time with them, even if it's, you know, virtually by camera or anything else. That's what I'm saying. So yeah, it sucks. Trust me. No one wants to use half a year or 2 years. No one wants to lose that. But if there's a chance to save even the older people, and they may come to a point where they say, okay, well, we're ready to start doing social distancing or release social distancing and start the herd immunity process for younger people, but they're definitely not going to let the older people out in that setting. And so you may say, why don't we do it right now? Because ourselves as society still the time to research the medicines that can work, right? That can work before the vaccine comes in. Because every single medicine that we've tried to use isn't working right now. Every single one. Hydroxychloroquine doesn't work. Remdesivir doesn't work. Kevzara, oh, there's new data on Kevzara. That doesn't work. That's another medication that doesn't work. So they're looking at acetemra and all the ones that you've heard about, ivermectin and nicotine and vitamin C. By the way, they're giving vitamin C in high doses in the ICUs in New York and everything. And even that's not working. And again, this new one of the, what is it? Not Famotidine, the Pepsid AC. So they're testing everything. So we need to give everyone some time to hide away while we figure out which medicines can work both in the outpatient setting and when you get really sick. So Maria also mentions, have I heard about the app they want to use in Europe and Australia? What do I think? So Valeria, I think you're talking about the app, the social distancing app. And they're using it in Australia, Ray, too. I think there's this app, and you're either one of two people, where you either think that you're okay giving up your privacy to help the greater good, or that you're not okay with giving up privacy. And what this app supposedly does, if I think it's the one that Valeria talked about, is it's an app where you download the app, and then it's a location-based app. And then if you're walking around and one day they find out that there's a huge cluster at like that restaurant that you're planning to get takeout from or whatever, it will notify you right away that, uh-oh, there's a cluster there and you're nearby it, so you shouldn't go there. And it gives you early warning. So I think it's a great system if a lot of people use it. If no one's using it, if only like 10% of society uses it, then it's not that useful. People have to trust it, but people have to be willing to give up their privacy. And I don't know that people are willing to do that. Even in Singapore, for example, they tried to start up that application, the distance-based like contact application, notification application, and only 16% of people in Singapore use it. And Singapore is used to giving up a lot of their rights for the greater good and used to strong rules. And if Singapore only uses it like less than 20% of the time, it might not be that useful. So Daniel asked, if there are 6 companies working on the vaccine, Daniel from LA, are they working with shared research and testing with separate hypotheses, or are they working isolated? Daniel, that's a very good question. I don't know how the companies are doing it. You know, you may imagine, I think they are sharing a lot of the initial research coming out of China, and they're using basic stuff. But as you can imagine, most of those companies have a proprietary hold on the vaccine. They want to make money off of it eventually. Now, it's a very fine balance in public health, right? You cannot, even if you make a vaccine tomorrow, you cannot charge $1,000, $10,000, or even $1,000. You may not even be able to charge $100 for the vaccine, because if you're seen as charging too much money for this vaccine, all of society will come down hard on you. You know, so the initial company that makes this vaccine is not going to make a lot of money right away. Their stock might go through the roof, but physically in terms of money from it, they may not make a lot of money from it, but they are still probably owning certain proprietary technology to amplify that vaccine, the inactivated virus, or do other things. So, you know, Daniel, I think they may be sharing some data, but they're probably not working all together, because they want to be first. They want to be the ones that, you know, help solve, even just for bragging rights, you know, for the Nobel Prize, you know, whoever discovers the vaccine for COVID-19 and does it fast or does it well, or a drug that works, they are going to get the Nobel Prize. I guarantee you they will get the Nobel Prize, and not like Trump said for the Pulitzer Prize for, you know, reporting, but they will get an actual Nobel Prize for medicine if whoever figures out how to treat COVID-19. That's a slam dunk. Everyone knows that. If they manage to save most of humanity or get us out of social distancing, you know? So Lauren mentions, in New York, as of last week, they're still using hydroxychloroquine. Yeah, Lauren, you're right. You know, I actually asked my friend, and I don't want to mention his name because I don't want to get him in trouble, but he is an ICU doctor, the one I've talked about all my podcasts, that works with the really sick ICU patients in Long Island, where he's taking care of like 40 patients a day. I talked to him just 2 days ago. He says all told, he's taking care of 132 really sick COVID-19 patients. And I asked him, I said, listen, the NIH just released all their recommendations and they don't recommend anything. So I said, so are you still giving that medication, hydroxychloroquine? Are you still getting remdesivir and doing whatever? And Lauren mentioned, she says, I know patients released from hospital after given hydroxychloroquine and recovered. Some of them had multiple issues and were rehospitalized. So again, you know, the point is the hospitals are really confused right now. They're trying to reset their protocols. Some are still using it, even as of last week and maybe even as of this week. and some are not, because we don't know what the new data is going to show. Again, a few days ago, Remdesivir data was really bad coming out of China. But in a week or two, the studies will come back, and they'll be from Gilead. I almost guarantee you they'll look good, because Gilead didn't design the study well. They designed it to make Remdesivir look good. So in a week or two, Remdesivir is a great drug and it work again, and it'll be back on the protocols again. But the NIH won't put it as a real recommendation, because of that. Lauren and Daniel mentioned, speaking of companies, do I see a bubble for companies profiting off of ventilators, testing, and vaccine solutions? Yeah, Daniel, from a financial side, you're having like 1,000 companies do everything from antibody testing to vaccines to ventilators to 3D printing to everything. There's a limited profit margin from this. Some of these companies are doing it for donation. So I think there's not just a bubble. It's great that society is helping out, but in terms of being financially successful, every new company that has a new drug, suddenly their stock shoots through the roof. When it doesn't work out, what happens? Their stock plummets again, if they're even traded or not. And you're not going to make a lot of money off of this stuff. So I'd be very cautious to invest in a company or any pharmaceutical company. If I were to invest, I would invest broadly in a biotech ETF or something like that. Because generally, healthcare and, biotech may do better than, like, let's say the airline industry or the gas industry or energy industry. But I can't tell you which one's going to do well. You're right. Stacy says some people are only getting GI symptoms. And that brings me to another point. And Lauren mentions that they are still using hydroxychloroquine depending on the doctor. So that's the problem, is that it's very hard to diagnose this disease. As you mentioned, some people are asymptomatic. Some people are doing really nothing at all. They're not even having a cough or fever, or some are just having some nausea, vomiting, diarrhea, upset. Some people are getting weird things. You may have heard it, skin stuff. They're getting like weird rashes and weird things. But right now, the best case is that if you even think that you have COVID-19 or are suspected with it, or you live with someone, that you test it. And before, they weren't even recommending that asymptomatic people test it. And this is where I don't like the World Health Organization or CDC. I looked this up, by the way. You can test this. You can back test this, and you can look at Google. Did you know we've been wearing masks for what seems like forever? But did you know, and you can look back, that the World Health Organization and the CDC, they did not officially recommend the mask to go outside until around April 3rd or April 6th. Think about that for a while, okay? Only April 3rd or April 6th. Now remember, when did it start in China? End of December, or they're saying November. By January, everyone knew this was a problem in China. By the end of January, they were saying it's going to be a pandemic. So why did it take them common sense to stay until April to recommend wearing any masks? That's 3 months, February, March, or 2 months, 60 days that you lost, that you didn't let people recommend wearing masks. What's the problem with wearing a fabric mask? I understand the surgical or N95, but anything? I mean, that's kind of a problem, And so if you can, again, we can play the blame game all day. I'm just saying that the World Health Organization and CDC wait a very long time to make recommendations for drugs, for anything. They want to see the real data, so they will only wait for the best studies before they make those recommendations. And my Instagram Live, as you know, is going to end pretty soon because, unfortunately, it only lasts 60 minutes. But again, I will restart it as soon as this ends for anyone on Instagram Live still watching. So I'm coming on an hour, and honestly, I am kind of tired. I'm on my night shift. I'm working 2 night shifts, and then I'm working 7 straight days. So unfortunately, my Thursday podcast will be a 8 p.m. Hawaii Standard late podcast. But again, it will be saved to Facebook, and it will be saved to YouTube again. And my Monday next week, it will also be 8 p.m. podcast. So Stacy writes, Stacy writes, anything on how we plan to keep Hawaii's economy afloat throughout this? Are there alternatives to tourism? Wow, Stacy, that's really, really above my pay grade. I have my own theories, and my own theories are based on looking at Hawaii. or looking at New Zealand right now. Okay, so Instagram's about to end. Just give me a second. Let me restart Instagram right now, and then I'll answer that question. Um, okay, I am restarting Instagram Live. So, Stacy, again, so how do I think that we can keep Hawaii's economy afloat? I would look to New Zealand as a great example about how we do it. Because New Zealand is very similar. It's an island country. Welcome back to Amy from Vegas coming into Instagram Live. Is that they are, and welcome to Linda again on Instagram Live. You know, New Zealand is shutting down their country, just like Hawaii can shut down their island to any foreign visitors unless they're tested negative by test. I mean, New Zealand's not even letting any foreigner come in, test or no test, but they will open up eventually to all Americans and maybe international, but at least Americans. And welcome back to Valeria from Ukraine. That they'll open up to Americans that take the test, but I think they're going to have to focus on domestic travelers and even Hawaiians that can travel to Maui. Like they're going to recommend Oahu people go travel to Maui and travel to Kauai and travel to Big Island and bring domestic tourism back. The only other business I can imagine is that there are going to be a lot of those other industries that involve around construction, you know, maybe building more shelters for homeless people, or you know, certain other things. They're going to have to, you know, for example, the service industry, the restaurants, a lot of those things, and bars, and you know, there's going to have to be a way to redesign the concept of going out to eat, going to get a drink, and not necessarily being right next to each other, right? Like they can partially open up restaurants if you can keep people like 10 feet away from each other, or keep people in private cubicles, right? Private booths, like they'll only let people go into private booths and out of private booths, right? Then you're sort of social distancing. So there's gonna be this whole idea about how you redesign a restaurant right now, how you redesign. They're even talking about, you may have seen some of these ads where they're redesigning airplanes, right? Like redesigning airplanes where the middle seat is facing outwards or forwards and the aisle and window seat are facing backwards. So they're gonna have to redesign how planes look. And maybe even in movie theaters, like I said, when they reopen movie theaters, only selling every third seat and every other row. So it'll be a problem. Some of these industries, movie industry, that's not even the filming industry. They can't even film new movies. Like you saw, Saturday Night Live was a live episode and it's just done like Zoom style or on the internet. They can't really film stuff, and so they're gonna have to redesign how they do these industries. So Brian Oahu from Hawaii mentions Vietnam populations, 95 million only, 220 cases and 0 deaths. Wow, Brian, I didn't know they had 0 deaths. I gotta check that because they did it right. Brian, now I know Vietnam has been really hardcore with their contact tracing and their things, but they have very big populations. Like Ho Chi Minh City, I've been there, is a very tightly packed urban thing. So the only thing I would caution against those numbers is that sometimes you may have to ask how much testing did they actually do, right? How much testing did they actually do in Vietnam? Like how many tests were done in the world in Vietnam, you know, or in the world, and how many were done in Vietnam? Now let me check some of these numbers real quick. In terms of, so it looks like in terms of tests, you know, I can't even really find Vietnam on the, wow. Okay, so total tests per million population. I don't know that Vietnam has done a lot of tests, Brian. Maybe on the internet. Oh, so Vietnam, okay, cases, and they've tested per capita. They've tested about 2,108 per million, or about 18 per 100,000. So they're actually testing very well. So I take that testing very well. Again, the U.S. and the CDC, they have essentially recommended that test about 150 people that you're doing well with information. You can use that information to open up. Daniel, what's the site's URL? Daniel, the one I use to look at statistics is worldometers.info, worldometers.info/coronavirus. That's the best site to look at all the statistics, the graphs we're looking at, and you can look at the columns and switch it up for tests per million or deaths per million. Or the three most important columns to look at. Don't look at cases or total cases or total deaths or total tests. You always got to adjust it per capita, adjust it per million. And that's the site I use all the time since it started in January. And that is where I realized I was wrong, because I admit I was wrong. And a lot of my friends tell me, you were wrong. You said it was like the flu back in January. And when I started seeing how bad things were, I changed my mind by middle of February. Again, I was late. I was as wrong as like Fauci was, World Health Organization, whatever. But I know most of you know that I've been talking about since like the end of February that how bad this could be. So Greg mentions, I heard New Zealand, Australia are going to open up each other while keeping most other countries travel restricted for a while. Greg, you probably know more on the ground than I have. The last I heard, Greg, New Zealand was not letting any foreigners in, but it makes sense they would let Australia in because, again, Australia's numbers are really good. They're not as good as New Zealand, but they're very good, and they're better than most of the other rest of the world. So it would make sense Australia and New Zealand allow each other to come back and forth with some other restrictions. But if you're planning to go to New Zealand or you're planning to go to Australia and you're a foreigner, my bet would be that you're not going to be able to go there for a while. Maybe they will let New Zealanders and Australians into other countries, but then when they come back, they're going to have to be quarantined again. And as if you remember one of my old podcasts, when they quarantined my friend who's Australian when she came back from England, she was working in England and she flew back to Sydney, they locked her in a room. They locked her in a hotel room for 14 days, like a real quarantine. None of this like honor code quarantine where they trust you or they kind of call you. They literally they had like a quarantine hotel. And I would hope that maybe okay, this goes into Stacy. Stacy, maybe they would I think the one way they can open up Hawaii to, let's say, quarantine out of the quarantine, or to open up for tourism, is to have one hotel just be the isolation hotel, or maybe 10 hotels. And the hotels may be like, oh, well, we don't want to get COVID-19, but guess what? They want money, they want to put their people to work, and they don't want empty hotel rooms. So maybe those hotels will volunteer to take all those people and be the quarantine hotel, right? So that's how I think Hawaii will slowly reopen up. Yeah, Daniel, that Worldometers, Daniel asked, is there any statistics that factor in population density, tests, cases, deaths, and recovery and reinfection? Oh, well, actually, I take that back, Daniel. Yeah, no, the worldometers.info/coronavirus only looks at it per capita, per 1 million. It doesn't look at density. The only way you can figure that out is really looking and doing it yourself, looking at the states that have the highest population density. That would be California, that would be New York, that would be, again, like Chicago and Illinois and like Massachusetts. Those would be states that tend to have higher population density, but again, outside the city, they don't. So I don't know that I've seen any good website that looks at per city, like New York City and Boston and Chicago specifically. I haven't found anything. If you find anything, let me know. Amy says, from Instagram, says, there's so much misinformation out there. Thanks for your logical approach to all of this, and it's refreshing to see a broader view throughout this. So yeah, so again, I'm going pretty long. It's about an hour and almost 10 minutes for me, and I am tired, so I think I'm going to end this a little early and take a nap, and then maybe get back out there to surf because it's a decent day, and I need some lunch. So welcome to LaShawn again. So I'll summarize it by just saying that I think the good news is that, again, the U.S. and Hawaii specifically as a whole, we are doing really well. And we have looked at passing that peak, not only on the curve, we're coming down on the curve. So we are starting to do that, but now is not the time to get complacent. We need, as we open up the rest of the states and the rest of the cities, and welcome to Daniel coming in, as we open up the rest of these places, we have to look at the test states and the test countries, the Singapores, the Japan, the Georgia, the Florida. We really need to look at what happens when they reopen up certain industries. Are they safe or not? I mean, just go and Google one city or one area, just one, and you'll see what happened when they reopen. Hokkaido, Japan. If you take nothing out of this podcast, look up Hokkaido, spelled Hokkaido, I think, or maybe it's 2 Ds. Hokkaido, Japan. They're very similar to Hawaii. They're an island city, and they were doing really well. They were really flat in the curve and ended. And then what did they do? They reopened themselves, not even for the rest of the world, just to Japan. And so everyone was stirred crazy and wanted to go travel somewhere. So everyone flew in from Tokyo to Hokkaido, from Kyoto to Hokkaido, everything. And guess what happened to Hokkaido, which is a lesson for specifically Hawaii, but for any other state, they're getting slammed right now with a second wave. So the good news is I think we're finishing and on the way down every single state, including New York and New York City, with our first wave. The question is, how do we avoid the second wave? And do you believe, like all the conspiracy theorists, that we should just get herd immunity and let everyone do whatever they want? Or would you rather still limit something and limit the worst industries that are crowded, and the crowding on the beaches and the crowding in movie theaters and the crowding in the bars or whatever? Everyone thinks there is either or. Either you keep everyone inside or you keep everyone together. What I'm saying is there is a fine line and there's a logical way of reopening it slowly. You cannot do it all at once, or we're going to be Hokkaido, or we're going to be Singapore again. And then we're going to have to shut down and do this all over again for another damn month. And we don't want to do that, okay? So, and Mike Andreas, my good buddy from Herrick's, welcome, Mike, says, thanks for the info, stay safe. So anyway, guys, with that, I think I'm going to end. There's no real new advice I want to give you with that. Again, just keep washing your hands. If you're going to go out, please use that at least, fabric cloth mask. Some are better than others. Oh, there's one last thing I want to give with the mask. They are showing, a lot of people don't realize the CDC is not officially recommending, you see some of those N95 masks that have the filter that lets you breathe out and breathe better. A lot of people don't realize that that's not necessarily as safe. And I don't mean it's not safe for you. Remember, masks are more for you to protect you from breathing out for other people. So, fun fact, the CDC is not recommending that you use that N95 with the filter mask. They don't recommend it because you're breathing easier, that means you are breathing out. So if you're asthmatic, or maybe you're even sick with a cough, that mask is not protecting you or protecting other people from you. In other words, it may be easier to breathe, and it may be okay to use around everyone that you trust, but if you're going out in public, it is not exactly the best mask to use. But my point is, use your mask, wash your hands, do the logical thing. The opportunity as your state or city, because I don't know where all you are from, to go somewhere, do it, but do your social distancing. If suddenly a bar says we can do social distancing and come, we're having a social distancing happy hour, and you walk and you look in and everyone's crowded, I would just go to another bar, guys, or not bar, I would just go to another restaurant where maybe they let you sit at a bar is every fourth stool or something, and they don't let one in after that. I would go to that bar. Just be smart. It's not, don't be one of those idiots that injects bleach because someone tells you to do that. Do the logical thing. I'd like to think that most of my friends and most of you watching this are that way. And, I educate your family and friends, and that's why I do this along with my therapy of unloading a little bit to the greater good. So anyway, that's it. So again, I'm Dr. Albert. News later, and hopefully better news by Thursday, because so much changes day to day and maybe even later. So again, you can add me on Instagram at _MD, on Twitter, the Traveling DR, and again on YouTube at the Traveling Doctor, and on Facebook. So stay safe and just stay healthy. And again, we're in this together, but we will all come through this for sure together, one way or another. Okay, so stay safe, and I will see you guys on the other side. Aloha.